Welcome to Module 5 of Foundation of Nursing 3. In this session, we will discuss health education in nursing, a vital tool for preventing illness, promoting healthy behavior, and empowering patients and communities. Health education goes beyond lectures and posters. It is about communicating health information effectively to create lasting change in knowledge, attitude, and behavior. Compass definition and importance of health education. Health education is the process of providing information and teaching individuals or communities how to improve and maintain their health. Directed the goals of health education. To inform individuals about diseases and how they are transmitted. To encourage healthy behaviors and lifestyle modifications. To empower communities to take charge of their own health. To reduce preventable diseases through early awareness and intervention. As a nurse, you play a frontline role in delivering health education in hospitals, clinics, homes, and schools. Brain how to present a disease condition. To educate patients or families about a disease condition, the nurse must follow a structured, empathetic, and understandable approach. Clipboard steps to follow. Introduce the topic. Begin with the name of the disease and why the patient or group needs to understand it. Example: today, we are discussing hypertension, a condition that affects blood pressure. Define the condition. Use clear, non-technical language. Example: hypertension means the blood is pushing too hard against your blood vessels. Explain causes and risk factors. Include diet, lifestyle, environment, or heredity. Eating salty foods, not exercising, smoking, and stress can raise your blood pressure. Discuss symptoms and early warning signs. Emphasize early detection. Hypertension often has no symptoms, but some people experience headaches or dizziness. Describe preventive measures. Focus on what the patient can do. Reduce salt in your food, take walks daily, and check your BP often. Include complications if untreated. Help them understand the urgency. If not managed, hypertension can lead to stroke or heart failure. Offer supportive tips and resources. Provide take-home advice or refer to support groups. Light bulb principles of effective health education. Use simple language, avoid medical jargon. Be culturally sensitive, adapt messages to beliefs and customs. Interactive delivery, use question and answer methods. Use visual aids, charts, pictures, or real-life objects help understanding. Involve the audience, ask them to repeat or explain what they've learned. Be patient and compassionate, remember, learning takes time. Stethoscope common health topics nurses teach about. Hygiene and sanitation. Importance of hand washing. Use of clean water and food handling. Maternal and child health. Exclusive breastfeeding. Antenatal visits. Family planning. Non-communicable diseases. Hypertension. Diabetes. Osteoporosis. Infectious diseases. Malaria prevention. Tuberculosis. HIV, AIDS awareness and stigma reduction. Nutrition. Balanced diet education. Infant feeding practices. Prevention of malnutrition. Mental health awareness. Stress management. Signs of depression. Encouraging counseling. Toolbox health education tools and methods. Depending on the setting, you can use individual teaching during bedside care. Group health talks in clinics or waiting rooms. Role-playing or dramatization. Community outreach and home visits. Pamphlets, posters, and radio programs. In Nigeria, for instance, health talks are given daily in antenatal clinics and immunization centers, often in local languages. Handshake patient involvement and behavior change. Health education should not be a one-way conversation. You must encourage the patient to participate actively. Use motivational interviewing, a technique that supports patient-driven change. Example: instead of saying, "You must stop eating oily food," Ask, how do you feel your diet affects your health? What small change can you start with today? Behavior change is more effective when patients set their own goals. The nurse follows up consistently. Barriers are addressed realistically, e.g. poverty, beliefs, access. Triangular flag barriers to effective health education. Low literacy or poor understanding. Language barriers. Cultural or religious beliefs. Fear or stigma. Lack of trust in healthcare system. Poor listening or judgmental attitude from healthcare workers. As nurses, we must address these barriers with empathy and patience. Health education must empower, not shame. Pushpin case study, teaching a diabetic patient. Let's consider a practical example. Patient, a 50-year-old man, newly diagnosed with type 2 diabetes. Education plan. Explain what diabetes is and how it affects blood sugar. Discuss healthy eating, smaller portions, less sugar. Teach how to use a glucometer. Discuss food care and warning signs. Involve family in diet planning. Schedule a return session to review progress. GREECYCLE. The goal is for the patient to take control of their condition with your support. White heavy checkmark summary of Module 5. In this module, we explored the definition and purpose of health education in nursing. A step-by-step guide to presenting disease conditions. Key principles and teaching methods. Common topics nurses are expected to teach. How to overcome barriers. Welcome to Module 6 of Foundation of Nursing 3. In this lecture, we will explore basic hygiene and personal care, focusing on essential procedures like oral toileting, bed bathing, and how to apply observation during routine nursing care. These procedures are not merely routine. They are moments of intimate clinical contact where a nurse can assess, educate, comfort, and build trust with the patient. SOAP 1. The importance of personal hygiene in nursing. Personal hygiene is critical to preventing infection and complications, promoting comfort and dignity, supporting mental and emotional well-being, observing changes in a patient's physical condition. In settings like hospitals or long-term care, some patients depend entirely on nurses for hygiene care. Mouth 2. Oral toileting, mouth care. Oral toileting refers to the routine cleaning of a patient's mouth, teeth, tongue, and gums to maintain oral hygiene and comfort. Light bulb. Why it matters. Prevents mouth infections like thrush or gingivitis. Reduces halitosis, bad breath. Improves taste and appetite. Supports respiratory health by reducing bacteria that could be aspirated into the lungs. Essential in unconscious or critically ill patients. Toolbox equipment required. Gloves and apron. Toothbrush or oral swabs. Toothpaste or antiseptic mouthwash. Cup of water and kidney dish. Towel and disposable tissues. Tongue depressor, if needed. Memo procedure. Wash your hands and wear gloves. Explain the procedure to the patient if conscious. Position the patient upright or on their side, for unconscious patients. Protect clothing or bedding with a towel. Brush all tooth surfaces gently or use swabs soaked in mouthwash. Rinse the mouth using water or mouthwash and suction if necessary. Wipe the mouth and lips. Remove gloves and wash hands. Warning: special considerations. In unconscious patients, use minimal water to prevent aspiration. For mouth ulcers, use soft swabs soaked in saline. Dentures must be removed, cleaned, and stored hygienically. Bed 3. Bed bathing. Bed bathing is the process of cleaning a patient's body while they remain in bed, typically because they are immobile or too ill to shower. Shower. Purpose of bed bathing. Remove sweat, oil, and dirt. Stimulate circulation. Observe for pressure ulcers or rashes. Promote comfort and well-being. Maintain patient dignity. Toolbox equipment needed. Basin with warm water. 2 towels and 2 washcloths. Mild soap or antiseptic cleanser. Gloves and apron. Clean clothes or gown. Lotion and deodorant. Comb and nail file, optional. Memo procedure. Explain the procedure and gain consent. Close windows, draw curtains for privacy, and remove any jewelry. Wash your hands and wear gloves. Help the patient into a comfortable position. Start from cleanest to dirtiest areas. Face. Neck and chest. Arms and hands. Abdomen. Legs and feet. Back and buttocks. Genital and anal area last. Rinse and dry each area thoroughly. Apply lotion and change the linen and clothes. Document skin findings or unusual observations. Warning safety tips. Always maintain privacy. Use gentle, firm strokes to avoid irritating the skin. Observe for signs of bed sores, skin tears, or infections. Avoid unnecessary exposure to cold. Magnifying glass tilted left for. Observational skills during hygiene care. During personal care, nurses have the opportunity to assess the patient's skin condition, rash, dryness, bruises, pressure sores. Mental status, alertness, confusion, response to stimuli. Mobility and pain, reactions during movement. Oral health, bleeding gums, dryness, odor. Vital signs, if done during morning care. Every hygiene session is a clinical evaluation opportunity. Brain 5. Practical demonstration tips for student nurses. During your clinicals and demonstrations, practice correct technique and infection control. Communicate clearly and respectfully. Encourage patient participation when possible. Maintain dignity and modesty at all times. Keep water at a safe, warm temperature. Record and report any abnormal findings. Blue Book case scenario, full bed bath for a stroke patient. Patient, 68-year-old male with left side hemiplegia post-stroke. Special needs. Cannot turn himself in bed. Partial incontinence. Slurred speech. Procedure. Use 2 nurses to ensure safe turning. Place waterproof sheet under him. Clean from unaffected side first. Use gentle reassurance and maintain eye contact. Apply moisturizer to prevent dryness. Clean catheter side gently if in use. Use barrier cream around perineum. Green circle document any new redness, bruising, or skin breakdown. White heavy checkmark summary of Module 6. In this module, you have learned about the importance of oral hygiene in nursing care, the correct technique for providing mouth care, how to perform a safe, effective bed bath, how to use hygiene moments as opportunities for patient assessment, maintaining privacy, respect, and comfort during all procedures. These nursing skills are essential for compassionate, competent bedside care. They reflect both your technical ability and your commitment to human dignity. Welcome to Module 7 of Foundation of Nursing 3. In this session, we focus on the practical demonstration of core nursing skills, the hands-on clinical procedures that form the foundation of safe and effective nursing care. These include monitoring vital signs, performing wound dressing, administering injections, working in team-based nursing procedures. Mastery of these skills is required for clinical proficiency, patient safety, and successful completion of your nursing training. Drop of blood 1. Monitoring vital signs. Vital signs provide essential information about a patient's physiological status and help in early detection of deterioration. Clipboard the 5 vital signs. Temperature, T. Pulse, P. Respiration, A. Blood pressure, BP. Pain, EP, the 5th vital sign. Toolbox equipment. Digital or mercury thermometer. Sphygmomanometer and stethoscope. Stopwatch or watch with the second hand. Pulse oximeter, optional. Pain rating scale, e.g., numeric or visual scale. Memo technique summary. Explain procedure to the patient. Ensure the patient is relaxed and seated or lying. Measure each sign accurately and record findings. Report abnormalities immediately, e.g. BP greater than or equal to 140/90 or pulse less than 60 bpm. Green circle observe trends, not just isolated readings. Adhesive bandage 2. Wound dressing. Wound care is critical to prevent infection, promote healing, and monitor recovery. Light bulb types of wounds. Surgical incisions. Pressure ulcers. Traumatic injuries. Diabetic foot ulcers. Toolbox dressing tray setup. Sterile gloves. Antiseptic solution, e.g., normal saline or povidone iodine. Gauze pads. Forceps and scissors. Sterile drape. Dressing pack or adhesive bandages. Waste disposal bag. Memo procedure. Wash hands and wear gloves. Explain the procedure to the patient. Position patient for access and privacy. Remove wound dressing gently and assess wound. Clean wound from least to most contaminated area. Apply clean or medicated dressing. Secure dressing and document wound condition. Warning: observe for odor, excessive drainage, redness or swelling, signs of wound infection, pain, warmth, fever. Syringe 3. Administering injections. Injections are a common route for medication delivery, fast, accurate, and useful for emergency or non-oral treatments. DNA types of injections. Intramuscular, IM, e.g., in the deltoid or gluteus. Subcutaneous, SC, e.g., insulin injections. Intradermal, ID, e.g., tuberculin testing. Intravenous, for through the vein, typically in hospital setting. Toolbox equipment. Syringe, appropriate volume. Needle, correct gauge and length. Prescribed medication. Spirit swab. Sterile gloves. Sharps disposal container. Memo procedure, intramuscular injection. Verify drug and patient identity. Draw medication using aseptic technique. Select appropriate site, deltoid, vastus lateralis, or dorsogluteal. Clean site with alcohol swab. Insert needle at 90 degrees angle. Aspirate if required, check for blood return. Inject medication slowly. Withdraw needle and apply cotton wool. Dispose of sharp safely. Document time, site, drug, and any reactions. Yellow circle: always observe the patient for adverse reactions after administration. Boston Silhouette 4. Team-based nursing procedures. Teamwork is essential in nursing care, especially during emergency response, CPR, resuscitation, surgical preparation and assistance, patient transfer or turning, coordinated wound dressing in large injuries, deliveries and episiotomy care, antenatal procedures and newborn care, handshake nursing roles in a team setting. Lead nurse coordinates procedure, assigns roles. Assistant nurse supports with equipment or patient handling. Recorder documents actions, findings, or timestamps. Observer monitors patient response and safety. Green circle: effective teamwork requires clear communication, respect for each role, shared responsibility, good time management. Brain clinical tips for skill demonstrations. When participating in practical demonstrations, be neat, organized, and hygienic. Use gloves and follow aseptic techniques. Always explain the procedure to the patient or model. Respect privacy and consent. Practice beforehand to gain confidence. Use checklist provided by your instructors. Blue Book case study: administering an IM injection to a diabetic patient. Scenario: 65-year-old woman diagnosed with type 2 diabetes requiring vitamin B12 injection. Steps: verify prescription and confirm identity. Prepare 2 ml vitamin B12 in a 5 ml syringe with 23G needle. Choose deltoid as injection site. Clean site and inject slowly at 90 degrees. Monitor for dizziness or allergic reaction. Educate patient on purpose and possible side effects. Document in patient's chart. Green circle education is part of every nursing procedure. White heavy checkmark summary of Module 7. In this module, we covered the demonstration and understanding of how to monitor vital signs correctly, steps for safe and sterile wound dressing, procedures for IM, SC, ID, and for injections, importance of teamwork in nursing procedures, clinical confidence and safety measures. Practical nursing skills are built through observation, repetition, feedback, and reflection. As a student nurse, you must be committed to both technical precision and compassionate care. Welcome to Module 8 of Foundation of Nursing 3. In this session, we will study a crucial area of reproductive and maternal child health, antenatal procedures and newborn care. As nurses, you play a pivotal role in promoting maternal health during pregnancy, assisting in labor and delivery, supporting early neonatal care, educating and empowering mothers on postnatal care. Your skill and compassion during this period can save lives and reduce maternal and infant mortality, a major priority in global and Nigerian healthcare systems. Pregnant Woman 1. Antenatal procedures. Antenatal care refers to the medical and nursing care provided to a pregnant woman throughout her pregnancy to ensure the well-being of both mother and baby. Directed goals of antenatal care. Monitor fetal development and maternal health. Detect and treat complications early. Prepare the mother for labor, delivery, and parenthood. Promote health education and nutrition. Reduce maternal and neonatal mortality. Receipt antenatal services include physical assessments, weight, blood pressure, abdominal palpation, urine test for sugar, protein, and infection, blood test, hemoglobin level, blood group, HIV status, fetal heart tone monitoring, tetanus toxoid vaccination, nutritional counseling, birth preparedness education. Test tube 2. Cervical cancer screening. Cervical cancer is one of the most preventable but still prevalent cancers among women, especially in low-resource settings. Brain. What is cervical cancer screening? Screening is the process of detecting abnormal changes in the cervix before they develop into cancer. Toolbox common screening methods. Pap smear, Papa-Nicolau test. Visual inspection with acetic acid, VIA, used widely in rural areas. HPV DNA test, for high-risk human papillomavirus detection. Memo nursing role. Explain the procedure to reduce anxiety. Obtain consent. Assist the patient into the lithotomy position. Provide instruments like speculum, swabs, and specimen containers. Label and send samples to the lab. Document findings and ensure follow-up for abnormal results. Yellow Circle educates women to begin screening within 3 years of becoming sexually active or by age 21, and to repeat at recommended intervals. Baby 3. Care of the newborn. Newborn care starts immediately after delivery and continues through the first 28 days of life, which is the neonatal period, the most vulnerable phase. SOAP. Immediate post-delivery care. Dry the baby to prevent hypothermia. Clear airway using a bulb syringe or suction. Clamp and cut the umbilical cord under sterile conditions. Assess using the APGAR score at 1 and 5 minutes. Initiate skin-to-skin contact and breastfeeding within the first hour. Administer vitamin K injection and BCG vaccine if available. Record birth weight and vital signs. Stethoscope. APGAR score explanation. The APGAR score assesses the baby's appearance, skin color, pulse, heart rate, grimace, reflex irritability, activity, muscle tone, respiration. Each is scored from 0 to 2, with a maximum total score of 10. Green Circle, a score of 7 to 10 is normal, 4 to 6 may need assistance, 4 requires emergency resuscitation. Face with head bandage 4. Care of episiotomy. An episiotomy is a surgical incision made in the perineum during childbirth to enlarge the vaginal opening. Brain indications for episiotomy. Prolonged second stage of labor. Fetal distress. Breech delivery. Large baby. Use of forceps or vacuum extraction. Memo post-procedure nursing care. Inspect the perineum for signs of infection or hematoma. Apply warm sitz baths to promote healing. Administer analgesics and antibiotics as prescribed. Educate the mother on perineal hygiene and how to clean the wound. Encourage fluid intake and high-fiber diet to prevent constipation. Monitor for signs of bleeding, pain, and infection. Baby bottle 5. Breastfeeding support and education. Breastfeeding is the natural and best form of nutrition for newborns. Glowing Star WHO recommendations. Initiate breastfeeding within the first hour after birth. Exclusive breastfeeding for first 6 months. Continue breastfeeding with complementary foods up to 2 years and beyond. Memo benefits. Provides complete nutrition. Protects against infections, rich in antibodies. Enhances mother-infant bonding. Reduces postpartum bleeding in the mother. Economical and always available. Graduation cap nurses' role in breastfeeding. Teach proper latching techniques. Help mother find comfortable breastfeeding positions. Educate about signs of adequate feeding, wet diapers, weight gain. Address concerns about nipple pain, breast engorgement, or mastitis. Encourage continued breastfeeding even when the mother is ill, except in certain cases. Debunk myths and cultural misconceptions. Green Circle supportive, non-judgmental communication is key to breastfeeding success. Blue Book case study, postnatal care for a first-time mother. Scenario. A 22-year-old primogravida has just delivered a healthy baby girl via vaginal delivery with an episiotomy. Nursing interventions. Monitor vital signs of mother and baby. Check perineal wound for bleeding or signs of infection. Support breastfeeding within 1 hour of birth. Educate on perineal hygiene and proper breastfeeding technique. Schedule follow-up for cervical cancer screening. Provide emotional support and counsel on danger signs, e.g., fever, foul discharge, poor feeding. Green Circle postnatal education should continue throughout the mother's hospital stay and during clinic visits. White heavy checkmark summary of Module 8. In this module, you've learned how to support maternal health through antenatal care and screenings. Assist with cervical cancer prevention. Provide immediate and continued care to newborns. Manage and educate mothers about episiotomy and postnatal healing. Promote and support breastfeeding practices. These skills prepare you to care confidently and professionally for both mothers and newborns, improving health outcomes across communities. Welcome to the final module, Module 9 of Foundation of Nursing 3. In this session, we will explore Erik Erikson's theory of psychosocial development and its relevance to nursing care planning and interpersonal communication. Understanding how people grow, develop, and face emotional challenges at different stages of life helps nurses offer individualized, age-appropriate care. Brain 1. Overview of Erikson's psychosocial theory. Erik Erikson, a psychoanalyst, proposed that human development occurs through 8 stages, each characterized by a central psychosocial conflict. At each stage, successful resolution leads to healthy personality development. If not resolved, it may cause emotional or behavioral challenges later in life. Blue Book 2. The 8 stages of development and nursing application. Let's now break down each stage and examine how nurses can apply this knowledge in care. Baby Stage 1, Trust versus Mistrust, Birth, 1 year. Psychosocial task, developing trust in caregivers and environment. Positive outcome, a sense of security and reliability. Nursing implication. Encourage bonding between mother and baby. Support exclusive breastfeeding. Respond promptly to crying or discomfort. Educate caregivers on consistent and loving care. Child Stage 2, Autonomy versus Shame and Doubt, 1 to 3 years. Task: developing independence and self-control. Positive outcome: confidence in ability to make decisions. Nursing implication: encourage self-feeding, toilet training, and dressing. Use positive reinforcement. Avoid ridicule or punishment for accidents. Support the child's growing autonomy. Child Medium Dark Skin Tone Stage 3, Initiative versus Guilt, 3 to 6 years. Task: asserting control and initiating play and activities. Positive outcome: ability to lead and take initiative. Nursing implication: allow children to make small choices. Provide opportunities for play and creativity. Praise initiatives and avoid criticism that induces guilt. Adult Stage 4, Industry versus Inferiority, 6 to 12 years. Task: mastery of academic, social, and physical skills. Positive outcome: a sense of competence. Nursing implication: involve school-age children in age-appropriate health education. Allow participation in managing minor aspects of care, e.g., choosing bandage colors. Promote socialization during hospital stays. Avoid comparing patients negatively with peers. Adult Graduation Cap Stage 5, Identity versus Role Confusion, 12 to 18 years. Task: developing a sense of personal identity. Positive outcome: a clear and stable sense of self. Nursing implication: respect adolescent privacy and opinions. Involve them in health decisions. Offer counseling for risky behaviors, e.g., drug use, unsafe sex. Support exploration of roles and self-image. Woman Office Worker Stage 6, Intimacy versus Isolation, 18 to 40 years. Task: forming close, committed relationships. Positive outcome: ability to form loving relationships. Nursing implication: respect patient spouse/partner involvement in care. Provide counseling during relationship difficulties or childbirth. Encourage emotional expression during hospitalization. Family Man Woman Girl Stage 7, Generativity versus Stagnation, 40 to 65 years. Task: contributing to family, work, and society. Positive outcome: productivity and concern for future generations. Nursing implication: involve adults in community health projects. Encourage parenting support, mentoring, and vocational development. Educate on chronic disease management and lifestyle changes. Old Woman Medium Skin Tone Stage 8, Ego Integrity versus Despair, 65 years and above. Task: reflecting on life with acceptance. Positive outcome: wisdom and peace. Nursing implication: encourage life review and storytelling. Support spiritual and emotional needs. Provide palliative care with dignity. Acknowledge losses and support grief counseling. Stethoscope 3. Integrating Erickson's theory in nursing practice. Understanding these psychosocial stages helps nurses communicate effectively with patients of all ages. Provide age-appropriate health education. Set realistic care goals for each stage. Recognize behavioral and emotional needs during illness. Support mental health and psychological resilience. Green Cycle Nursing Care is holistic, not just about physical recovery but also about emotional, social, and psychological well-being. Blue Book Case Scenario: nursing a teenager with asthma. Patient: a 16-year-old boy admitted for acute asthma exacerbation. Erickson stage: identity versus role confusion. Nursing approach: allow him to make choices about inhaler use or visiting hours. Acknowledge his concerns about appearance, e.g., oxygen mask. Include him in his care plan. Provide counseling if he shows anxiety or depression. Green Cycle Respect and Involvement promote trust and positive identity formation. White heavy checkmark summary of Module 9. In this module, you have Studied Erikson's 8 stages of psychosocial development. Learned to identify psychosocial needs at each life stage. Connected nursing interventions with emotional and developmental tasks. Developed strategies to apply theory to practice in diverse clinical settings. By integrating psychosocial care into your practice, you will become a more empathetic and effective nurse, capable of supporting your patients holistically.